I would like to spend a few minutes telling you about what we've been doing at CareMosaic Equity Partners, where we've been pulling together efforts to try to go after large white spaces with great teams and seminal technology. Really, it's interesting being here today because this is just a few miles away from where the Home Brew Club was with Gordon French, Fred Moore, and ultimately, of course, all the great companies that came out of that. So it seems like it's a fitting environment for us to be talking about innovation and the disruptions in healthcare. And really wanted to give a few observations about what seems to be a perfect storm of opportunity. We think that there's never been a better time to invest in healthcare, and it's actually never been more difficult because it's hard to find the wheat for the chaff and to put the trends together. So what I wanted to do is spend a few minutes talking about the trends that I've been observing, our team's been observing, and how we're thinking about it, at least, a bit of an open source sharing as to how it may be possible to put together a very confusing environment into a few key themes that may help you in your own investment strategies. When you look at the landscape over the last 25 years or so, there have been some very seminal things that have been happening in digital health, and generally they've taken a long time to play out. What we're seeing right now is an acceleration, very remarkable acceleration, as we're hitting what I think is an exponential phase of growth as well as opportunity. And as we've been looking at it, there's really four efforts that we're focusing our attention on. I'm not going to spend a lot of time on these. Wanted to focus more on the trends, but just so you know some context. The first is we think AI drug discovery is going to be a very big deal. And I'll show you some data and McKinsey study. We think the market ultimately may be as high as $50 billion annually, and we're really just at the beginning. There are a number of companies that have come into the space. No one's anywhere near dominating yet, and we think it's a huge opportunity and huge arena. We have an effort called Intus, which was actually presented yesterday. A second area we think is a very big deal is the implication, what really is the second wave of digital health. There's been a huge investment in digital health. Many of you may already have properties. Most of those investments, and it's been probably $25, $30 billion over the last 5 years, most of those are in very thin slice and have very little market share. We think we're on the cusp of a second wave of digital health where there's actually going to be real integration into the delivery system. We have two plays ourselves. One is a care-at-home platform we call Raziel, and as another is focusing on telemedicine in China, Raziel Health and Raziel Health China. And finally, we think that really the biggest public health crisis of our time is global warming. And so we're working on an arena with a fascinating, Bill was just mentioning it, a fascinating new type of solar chip, completely different technology than silicon. It's 5 times the greater output than silicon. It's about 1/10 the price. We just submitted a paper to Nature, and that company is called Dimerant. So if you happen to be interested in any of these arenas, happy to talk to you afterwards. I mentioned that there's an acceleration of the opportunity in digital health. I wanted to talk really for a few minutes about digital health, and in that context say a few things about AI drug discovery. Really, this is driven by the fact that the largest sector in healthcare, which is really the hospital sector, is under extreme pressure. You may not know it. There's 6,000 hospitals in this country. More than half are going to be losing money within the next 5 years, according to an OMB study. More than half of the hospitals that you see when you're passing by in small town, big town America are going to be losing money. That's a very big stress on the system. Those systems have been operating under one set of assumptions, and those assumptions are going to change as their labor costs are crossing a curve, and they're actually increasing faster than their revenues. And so that creates an opportunity to change the model, but it's happening very slowly. What's happening is care, as everyone knows, is going from institutions to the outpatient. That's a great thing for digital health, but the uptake of digital health has been very slow. So when you look at it, there are new models that are starting to emerge, but they're actually just on the cusp. For example, There's new delivery platforms like DaVita and United Healthcare coming together. You may not know it, but United Health Group, which is the largest insurance company, actually owns 40,000 doctors. So you now have a kind of scalable Kaiser model. Hasn't yet been put together, but a lot of places that's going to be a player. You have places like DuPage Medical Group that themselves are becoming insurance companies, new types of ability to project doctors using an Uber technology like Pager, which is actually some of the founders of Uber. And then you have new arenas like Aetna, CVS, pharmacies, and insurance companies getting together. What's the significance of all this is that really an economy that's close to $4 trillion, now for the first time ever, there's opportunity for disruption. The question is, why is it going so slowly? And I think this is the answer. This is a map of the healthcare system. Try to figure this out. If you're a patient, it's even harder. People in healthcare can't figure this out. This is why healthcare is not like selling books online. Healthcare is much, much harder, which is why I say big opportunity, best opportunity we've ever had. One of the hardest things to do is to actually figure it out. So part of this is also has to do with how entrenched the current players are. And one of the themes that's really struck us is you got to figure out a way to get the cool new stuff coming out of here matched up with the old world that really can't, to be honest, and I tell this to my friends in the hospital and the insurance industry, very hard time thinking out of a paper bag in that industry because they've been doing it the same way for so long. How do you get those two to get together? How do you get new entrants to actually disrupt? So part of it is to look for subtle changes. As you may know, avalanches begin with tiny changes in the snow, and all of a sudden something big happens. So keeping your ear to the ground as to where is the change occurring, where could you actually get foothold? So we think there's really three big things sort of that those who've created unicorns and hectacorns, as they're called, have really looked at. I mean, one is really what's the customer saying? What's the vibe? What's the customer saying? What technology is going to make a difference? And finally, understanding how do you work across sectors and get them to work together? So listening to that vibe, there's not time today, but really there's a whole art. And if you really look into what Steve Jobs did, a lot of it has to do with really trying to get inside the customer's skin. And it's something that people talk about. Very few people do it well. We always try to start with what's the customer actually really saying, both physically, emotionally, socially, spiritually. What do people really want? The second thing is to look at what barriers there are that may be falling. And there's oftentimes subtle subterranean signs. Right now, for example, there are things that are happening in the delivery system that people aren't talking about that are going to be a very big deal. For example, this notion where there's something called bundles in healthcare delivery, which is the government under Medicare is actually paying for hip surgery, not just the surgery, but also the hospital stay, the rehab, the home care, all in one bundle. That creates a dynamic of innovation. So little corners of the industry that's happening, and they're expanding this. It was actually, you have to kind of follow the waves. There was a retrenchment, now it's on the uptick. And so this is the kind of thing that can create opportunity. And by the way, these are all the approved bundles, meaning there's potential to innovate in any one of these areas. If you see a technology that's in an arena where there's an established bundle, there's now a payment mechanism that's going to create accelerated change. And you can see that all these have been approved. Another thing that we think makes a difference is translating cool technology, and we've been following, and you have to map these spaces, as I'm sure if you're interested in investing, you do, but there's a whole ecosystem of emerging companies across some of these digital health spaces. We think AI particularly is going to have a very big impact. And here are three arenas in particular where just in this last year there have been some breakthroughs. One is in diagnostics. If you followed IDX DR, which the FDA has now approved using AI to diagnose diabetic retinopathy. People who have diabetes, changes in their eyes, our AI machine learning can tell that better than an actual ophthalmologist can. And there is now an algorithm that's been approved by the FDA. Similarly, Viz.ai has done this for stroke. Arteris is about to do it in cardiac, FDA approved. So there's signs that you can actually use AI in ways we never had thought were possible before, was more a concept 2-3 years ago starting to break through for diagnostics. Similarly, for risk prediction, I think this is cool stuff. Google now, and I saw some of this data as it was just coming out, they actually have retinoscopy. They can look inside the eye, the back of the eye, and this is what, anytime you go to an ophthalmologist, this is what happens. Look in the back of the eye, but they can actually predict whether that person's at risk for heart disease better, again, better than an ophthalmologist. A really neat kind of tool that we could use AI, and the question is, how many of these thin slices can we put together and how do you make it practical? Another one is Beyond Verbal and Mayo have done this, looking at people's voice actually changes when they have risk of coronary artery disease. So it's much like this company Roger.io, which was also out of the Valley, that's doing that, looking at digital exhaust out of cell phones to predict people who are at depression. We now can do this looking at voice for heart disease. And similarly, the cardiogram is looking at this, the heart rate variability. Your Fitbit can tell information that can predict whether or not you're at risk for diabetes. Really interesting stuff that would not have been immediately obvious. These kind of plays are going to be very big, we think, in the next 2-3 years. And finally, ecosystem orchestration. And Apple's really leading this with what they're doing with Healthkit, ResearchKit, creating a whole, opening up a lot of new data for doing clinical trials. So these are some breakthroughs in AI. Blockchain also is emerging, and there's a lot of companies in this space now in healthcare. These are some of the leaders that we think are going to do some really interesting things. AI drug discovery, as I said, is an arena that is also just beginning to emerge. There's been a lot of investment over the last 3 to 4 years. We think it's starting to enter into the kind of 2.0 age as well. Many of these companies are going after some similar techniques that are essentially looking at the literature to try to find issues, or taking current mechanisms for drug discovery and drug development and refining them. There's an emerging arena that also uses what's called systems biology to look at the complexity of the human cell and to try to actually create inferences around the complexity of biology. We think that in each of these categories, there are going to be some winners. What's fascinating is we think that people are way underestimating the impact. In the short term, there's going to be, and as it always happens, right? There'll be investments that end up being less interesting, and there's going to be there'll be a shakeout from them. But long term, we think this is going to have a huge impact, and it's hard for pharma to appreciate that because pharma has been using the same techniques again for so long. It's hard for the people in pharma to quite understand the significance of the computational biology on what they're doing. But there will be breakthroughs, and when the breakthroughs happen, it's going to have a massive impact. And as you can see, McKinsey's saying that there's a $3.5 to $5 trillion opportunity across AI, much of this in life sciences and drug discovery. And we think it's about a $50 billion annual market. So I'm going to end by just talking about, and I don't have time to go through all this. I think, Bill, are you, you're saying that time's coming up? Okay, so I'll end with, some 5 secrets we think to kind of predicting where some of the change is going to happen. Thinking globally across the ecosystem and acting locally, finding those thin slices, but understanding the significance of them, realizing that pure B2C plays will never dominate at the center of the board. In healthcare, at least, you got to get paid for, and you have to have the big revenue and cash streams in your favor. Software eats the world. In healthcare, business models are more important. So following the money becomes extremely important, and this is something that was lost, I think, on the Valley for some time. It's starting to become more important in people's thinking. I can't emphasize enough over the last 30 years, seen this a lot. And the fourth is keeping very, very current, because the waves are moving fast, and trying to understand really how to thread the technology together with the legacy players. The last one is really all about leadership, because, and it's an investment philosophy we've had, and it holds true very much in these spaces. It's the leadership, it's the strength of the teams, and it's the ability to be able to see the future, but also act in very, very specific ways today. So thank you very much, and it was a pleasure talking to you, and I hope you enjoy the rest of the conference.